Headache is actually one of the most common health concern and health complaint around this part of the world, maybe some other part of the world, but it's something that people often complain about, but yet it happens to be one of the most misunderstood. And for someone who's actually had that particular head in the pain for days that wouldn't go away, would understand how much of a discomfort that can be. And that's why today on the show, we decided to bring that topic to your doorstep, talking about headache. Good evening and welcome to Gyna, where we discuss health issues that affect women, girls, and children. And today we're talking about something that affects everyone, just like we did last week. My name is Doris Mayushishi, and this show comes up every Wednesday at 6 p.m. And of course, there's always a repeat broadcast on Saturday at 8 p.m. And we also have our active YouTube channel, Afia Culture and Lifestyle, where you can catch up with all of that information as to how you can live a healthy and better life. Very accurate health information from health experts. At this point, we'll take a break. I mentioned a while ago that we're going to talk about headache and all that you need to know, what different kind of headache means, at what point should you take action. You will know all of that today on the show. But after the break, you'll meet my guest, someone who was here last week, and we are lucky to have her back. Please stay tuned. Welcome back. You're still on to Gyna Plus on Afia Television, a women's health program that gives you tips to healthy living. We tackle all health issues, or most of the health issues that affect women and girls. But for today, we're talking about something that's quite general to everyone, and that is headache. And headache, you'll agree with me, that can be much of a problem, but sometimes it's just okay. I have my paracetamol, so I can be fine with it. So it goes and then you just sleep. But there could be more to it than just having a headache. So today, joining me in the studio to talk about this is Dr. Chiamaka Okereke, who is a consultant neurologist at the University of Nigeria Teaching Hospital, Itukozala. She was here last week to talk about stroke, and today she's giving us something more. This will interest you. It's good to have you back, Doc.
Thank you, Doris. Thank you.
Yes. Without wasting any time. During my introduction, the fact that headache it's just something that flies around every time. I have a headache, my head is aching, I just can't do it. So it's very common, but what are the things that really constitute a headache? At what point do I just, yes, what is it that constitutes a headache? I think that's the right question.
All right. Thank you, Doris. Thank you for having me. And thank you for allowing me to speak on headache, something I love to speak about all the time. So, question, what are headaches? Well, headache is any pain that is above the shoulder. So that's a headache. Anything above the shoulder, the neck, the face, the head, it's headache.
Oh.
Yeah, and let me just keep talking. There are two types of headaches, actually. We have the primary headache, where the headache is the illness. And then we have the secondary headache, where the headache is a sign or a symptom of another sickness or disease. So headache may not be as trivial as we see it. So headache can be the sign of common things like malaria, viral illnesses, down to tumors. Okay, so headache can actually be a very serious illness. Like I always say, headache is like that proverbial elephant that everybody is holding on to it and saying, I'm feeling the tail, it looks like a rope. I'm feeling the ear, it looks like a fan. Okay, so every physician has a hold on headache. Okay, but headache is not as simple as, it appears to be.
Yeah, I like the fact that you've given us that background. And I'd like to share a story, not like a story per se, but something that is quite common. Oftentimes we hear, someone has passed on. And what happened? You hear, what happened to the person? Say, he was just saying his head or her head was aching, and the next thing they slump and then they died. So are there everyday activities that, in as much as you've said there could be underlying health issues that, amount to, the head being what it goes through. But are there everyday lifestyles that, again, predisposes one to coming down with headache?
Okay, so we have different types of headache. Like I said, the primary headaches, the three commonest types are what we call the tension type headache, which is very common and almost everybody may have, experienced it at one time or the other. Then we have the migraine headache, which will definitely, or is the commonest headache that brings somebody to the hospital. Then we have the third group that we call, is a group, so we call them trigeminal autonomic cephalalgias. So that's a large, it's a large small group. The name is long, okay, but the number of sufferers are smaller than those having migraine. So for the migraine headache and possibly tension type headache, yes, there are things that can predispose one to have an attack, to have a headache attack. Okay, so common things, everyday things include not having enough sleep or sleeping too much. Yeah, not being hungry or even eating too much. Stress, okay, stress. Then for women, they are the menses, okay, or they are the female cycle, can be a predisposing factor for headache. All right. So then I am very careful about saying that things trigger headache or they didn't trigger headache, things like alcohol and all that, because most times it may just be what we call that the person is in the prodromal phase of the headache. So the person's head is already sensitized and prone to have the headache, and so the person is already, take for instance, most times people believe that chocolates, okay, can trigger headache, but we found out that what actually happens is that the person suffering headache is in the prodromal phase and is craving chocolates.
So what does prodromal actually mean?
Yeah, it's a phase like in commonest in migraine, where it just means the time before the actual headache.
It was actually going to happen.
Yes.
Regardless of that.
Regardless of that. So that's why I'm a bit careful to say that something triggered the headache, because what we are thinking now is that the headache made the person to crave. And then you now eat that thing and it now looks like it's that thing that caused the headache. Meanwhile, the headache was already, bound to happen. So the prodrome is the period before you start feeling the pain, when you are having other signs and symptoms that are not necessarily headache, pain. So we call them the non-pain. You're having the non-pain symptoms. So I'm a little bit careful to answer what causes, what triggers. Okay. That's why I'm bringing this in. But in fact, the commonest things that trigger headache is change. Any change. Change in the number of hours of sleep, change in the number of amount of stress that you're facing, change in the what we call the internal milieu of the body. So any change, triggers headache in people that are headache sufferers.
Okay.
Yeah.
So I like the fact that you said headache sufferers. So there are actually people who go through that more than others. So, but sometimes you hear someone say, "Okay, it's at the back of my head." Sometimes you hear them say it's affecting their eyes. Sometimes you say by the side. Different people with different kind of complaints. But at what point do I know which one is which really?
Okay, thank you. That was a great question. So migraine is a primary headache. That's a headache where the headache is the illness. So when people say they have migraine, I believe some people just say I have migraine. They like the term, okay. But what migraine is actually is that headache that is four things: is pulsatile, it's unilateral, is moderate to severe, and then is worsened by movement. So if you have 2 out of these 4 things that I mentioned now, then you're probably likely to have migraine.
Okay, let's take it all over again. So I'd like you to explain one after the other. So it's
okay. So pulsatile means that it's throbbing, like they feel that their head is banging. Then unilateral means it takes one side of the head. Then moderate to severe means that the patient actually has to tell you, oh, it's mild, oh, it's moderate, oh, it's severe. So we usually tell them on a scale of 1 to 10, can you score the severity of this headache? So usually you could get a score of 6, 7. So that's a moderate headache. All right. Then the last thing is that is worsened by movement. So if you have 2 out of these 4 things that I mentioned, you're probably dealing with migraine. Then we have the associations, things that are associated with migraine, something like vomiting or nausea. Nausea is, feeling like you want to vomit.
Yeah.
Then photophobia, that's you don't want to see lights. And then phonophobia, you don't want to hear sound. So if you have one of these things I mentioned now, in addition to 2 out of the 4 that I had mentioned earlier, you may be dealing with migraine. So other things include neck pain,
you can't turn.
Neck pain, yawning, tiredness, weakness, feeling bloated, frequent urination. So all these other things are things that may happen. But the first things I listed are what we call the diagnostic criteria for migraine.
Sometimes what we do with before I even ask this question, there's one that comes to the back of your head.
Yes. Migraine can do that.
Okay, migraine goes round.
Yes.
Okay.
Can do that. It can come to the eyes. So.
Okay. So oftentimes we are quick to, self-medicating. We want to, we are easy to say, oh, because it's headache, I could just get Panadol and then get rid of it. But how much of a risk is that really?
All right. Now, because I've said that headache can just be the illness, or it may be a sign, it's better, okay, to work with a physician, because when people with headache come, our duty is to say which one, is likely to be a sign of a more serious thing. Then, by the way, migraines and other types of headache are not as simple. In fact, it's a brain disease now, actually. And the emphasis presently is to catch them young and treat them, so that they don't come down later, with other things. Like migraine now has been linked to dementia, and last week I said is a risk factor for stroke. So you don't want them to come down with other things. So it's important that you come to the hospital. And then again, there is something we call medication overuse headache. And that occurs if you have to take pain reliefs for more than 10 times in a month. So you may come down with another type of headache called medication overuse headache. It's more difficult to treat than migraine, and that's why if you are somebody living with frequent headaches, you may come to the hospital so that you're treated properly and you don't come down with medication overuse headache, and or at least you would have a better quality of life. Okay, so no amount of headache is ordinary. Pain is never a pleasant emotion. So you want to come to the hospital and get help.
Thank you for pointing this out, because up until now, I'm sure quite a number of us would never agree that headache is one thing that should take me to the hospital, to the point where you've explained it. You're still watching Gyna Plus. It's quite an interesting and eye-opening episode, if you ask me. We'll take a break, and once we're back, we'll talk more on what you need to know about headache. Please stay tuned. Welcome back. You're still watching Gyna Plus right on Afia TV. My name is Doris Mayurushisha, and we are dealing with something very interesting. The kind of thing that you want to say is very common. And it's just common headache now. So yeah, that's what we're talking about today. And I still have my very special guest right here in the studio talking about Dr. Chiamaka Okereke, a consultant neurologist at the University of Nigeria Teaching Hospital. Once again, thank you, ma'am, for making this really special, because I tell you, this is not the kind of information we get to hear anywhere, just anyhow. Because I could just go over the counter and get medication and say it's a headache I have. Now, talking about that, are there certain mistakes that, because I know people who are, you said people, headache sufferers, that's the word you used, and people who maybe persistently have headaches. Are there mistakes that they make that that the choice of word maybe predisposes them more to coming down with other illnesses that might be chronic?
Okay. Well, thank you. The first thing is that if somebody keeps having headache attacks, the first mistake is thinking that it's just common headache, okay, and staying away from the hospital. The common thing that people even do is that they just imagine, oh, I'm feeling unwell with a headache, maybe it's malaria, and they start treating malaria. So
It's a common practice.
yes, it's a very common practice. So no, they don't even think that it may not be malaria. So they just get anti-malaria, they take, and because you take pain relievers with anti-malaria, you may just calm the headache down. Okay, so one of the commonest things they do is this self-medication, taking the medication just at any time that they want. So the side effects of the medications are there. I know someone that kept taking the group of drugs that we refer to as non-steroidal anti-inflammatory drugs because of migraine. She came down with kidney failure. Yes, and now she's dead. So this is one thing that shouldn't happen to anybody. Had it been she came to the hospital, we would have placed her on drugs that would stop the headache. So she wouldn't have needed to keep taking those pain reliefs that now crashed her kidney and she died. Okay. So, and then other things, like I said, migraine is a brain disease, is a brain disorder. So let's treat it as that. You wouldn't, just like you wouldn't keep somebody that is having epilepsy in the home. The same thing, if somebody is having migraine, the person should go to the hospital. And another thing is that employers of labor, tend to trivialize this illness. Someone is sick, someone has a migraine, and people don't understand. Even in families, luckily once in a while I get to handle people with people tell me other things apart from medicine. I've seen couples that keep quarreling. Oh, she just because of common headache, she will not stand up and do the things she's supposed to do for the children and all that and all that. As I'm talking now, I remember a good number of couples that have had this issue, and I've had to explain this woman is sick. And funny enough, migraines are commoner in females. Okay, so I keep having to say, this woman is not well. Please, could you get help? And most times, because of the triggers, many times they have little children that wake them up in the night. Yeah. They are under stress and emotional stress in addition. So the predisposing factors are there. They are there. She has no help. She has 3 little children below 5, and she has to wake up. And the brain of a migraine, I usually tell them that, look, your brain is a special kind of brain. It doesn't want any disturbance. So you have to try and maintain stability. Stability in the number of hours you sleep, stability in when you eat, stability in the amount of stress. You can imagine when they go on holiday, like when they reduce stress, they have headache. So they need that stability. And most times, if anything that alters them, predisposes them to headache.
Okay, thank you so much. Now, as we wrap up, for someone who going to get down with headache more often, are there simple tips that could help them stay well?
Okay, simple tips that could help them stay well is, one, identify your trigger. So if you are able to identify your trigger, like my patients, I tell them, keep a diary, journal, keep a diary. If you are able to identify your trigger and you keep away from your trigger, you're not likely to have frequent headaches. So once you are able to pick up your trigger, then you avoid your trigger, then you will not have headache. But peradventure the headache comes, fine, what do you do? Try and hydrate yourself. You can use cold compress. You can stay in a dark, quiet room. Meditation helps a lot, okay? Meditation helps a lot. Deep breathing. So these are some of the things that you can do that will help. Of course, it makes sense because they reduce stress. So they now, tend to reduce frequent headaches and all that. So these are some of the things that they can
Okay,
bring.
so I know we're really running out of time, but that means a question just came to mind. One last one, just keep it as brief as you can. For a woman who's undergone CS, this is something that happened to me and it happened to a couple of other women. So day 2 into the surgery, you notice that your legs become very heavy, you can't turn around, they tell you it's a pillow, they have to give you some energy drink. Sometimes they just say,
okay, let me just,
yeah.
I know what you're saying, so that because of time. So that particular type of headache that happens after cesarean section is not migraine, please. It's most likely that you did a lumbar puncture, like the anesthesia was through your or the spine. So it's actually some form of low pressure headache. I said that there are different types of headache. So that's a secondary headache, showing that you lost some fluid from your CSF. And you notice that headache, when you lie down, you're fine. If you sit up, it comes up.
Talk.
Or if you talk, yeah, it comes up. But if you sit up, so common caffeine helps with that type of. So that's why we tell you take Coke or anything that contains caffeine will help.
Okay.
But it still happens to people that didn't have a CS. So that's why I said, if you have headache, go to the hospital. Headache can be even a sign of stroke. Okay,
which we talked about.
So it can be a sign of stroke. In fact, a type of the hemorrhagic strokes, the ones that deal with rupture of the blood vessel, comes with headache. You hear a person feeling like they were slapped, So, and they shout, "This is the worst headache of my life." That's a stroke. Okay, so headaches are not that simple.
Thank you so much. The thing is, we can go on and on and on. If we ask you, maybe we should have a second part of this discussion, because I don't feel like we just scratched the surface. Thank you so much, Dr. Chiamaka Okereke. It's been such a wonderful time coming on this show. And of course, it's really been an eye-opening session, like I said before. And we are glad that we had Dr. Chiamaka Okereke on the show today. Please do well to visit our channel, Afia Culture and Lifestyle. So if you miss out on Wednesday, 6 p.m., you can catch up with this episode on YouTube. Thank you so much. My name is Doris Mayum Shishe. Do have a lovely evening. Bye.